Yeah, I say let's get started.
Awesome. So again, hi everyone. My name is ARKA. I'm the managing director of the Data Economics company, and welcome to the Data Economics Festival. So this particular session is around creating a distributed database or a distributed engine for query engine for COVID and pandemic analytics. And this is more of a specific topic than most of the sessions that you might see at the Data Economics Festival. And we decided to, and a lot of these more specific topics around products that we are building at the data economics company or using the Lydion data economic operating system. These are kind of sessions that we are probably going to have later in the summer, and we have a lot more coming and we have a lot more to announce around that. But we wanted to have this festival mostly focus on the various interesting opportunities and challenges that lie in the various sectors that we are interested in as the data economics company, and highlight mostly the problems, the opportunities, and some of the people who are working, putting in their hard work, sweat, into solving those problems. Whereas in the future, we'll have a lot more sessions and a lot more discussions that focus more specifically on the solutions, so to speak, that we are building at the data economics company. Having said that, we wanted to have this session now because of how relevant this particular topic is. Obviously, something that has been at the top of mind for us, pretty much all of us for the past year plus at this point. And something that we think about a lot is what can we learn from the information, the data that's being collected in the world right now. We are living through a very unique period in history where we really haven't had access to this volume and this quality of data at any point in time before in our history, simply because the infrastructure that we have to collect, store, and analyze data hasn't just been available, even the last time that we faced a pandemic as a society, which was almost 100 years ago at this point. So it is a very unique time. The data that's being collected is a very unique data set. And we wanted to get a little bit of an insight from the people who are actually helping us think about and build out this solution. So before we get started, just a little bit more about the festival here. If this is your first session, you can learn more by going to lydion.com/festival. That's LYDION.com/festival, where you can find content related to the 20 panels, sessions on how digital data and data economics and economics intersect, as well as some really fun happy hour style events, such as a mixology class, which is tonight, a virtual golf clinic, and a live sing-along. And we're really excited to bring these topics to such a broad audience and across so many different sectors and interest groups, and would love to hear your feedback on other topics, other sessions. As I mentioned, there is a lot more coming through the summer that we could present to you around data economics, around how digital technology and digital data is impacting our world and our daily lives, and other similar topics. So with that, let's get started with a quick round of introductions with our very illustrious guest and the two semi-guests. Let's start starting with Charles. So Charles, would you want to give us a really quick introduction to yourself? Or
Sure,
not so quick, take your time if you want to.
sure. No, Arka, Jennifer, and SIRTAJ, thank you so much for having me participate here today. I really appreciate it. And obviously, I've loved working with you all on what we're going to talk about here today over time. So my name is Charles Darling. I'm CEO of Arcus Health. Arcus Health is a COVID response consultancy that came together as a collection of executives and professionals in the healthcare space across strategy, operations, finance, and sales that independently were called upon at the beginning of the pandemic in trying to help bring resources and other capabilities to ground here in the U.S. in response to the COVID-19 crisis. We then formalized ourselves in Arcus Health together and have been working as such since. We have in our work, we've worked with state and local governments, vaccine trial sites, companies in a number of different sectors and industries. on everything from healthcare services to products to both on the healthcare side as well as on the sanitation side, as well as then lastly bringing in public health experts or otherwise to advise those clients even further on building protocols and the rest. So it's been a pretty full plate that we've had over time and a set of experiences, and happy to talk about it here today.
ARKA, you're muted.
Yeah.
I got the very helpful message popping up that they've put up now. So so thank you for that. And yeah, this is it's very interesting how Charles first met us and our team and how we got started working together. But before we get to that, let's get to know our semi-guests. I say so because they're my colleagues at the Data Economics Company and are featured across numerous sessions at this festival. So Jennifer, in the off chance that someone has been living under a rock and hasn't heard of you, can you give us a quick introduction to yourself and your background?
Thanks, ARKA. That's really kind. You know, and actually I'll say for this session, I'm going to try as best I can to take off my pure data economics hat and put on some of my other hats I can wear. So by background, I'm a health economist. As far as my training, I'm also working on a PhD in evidence-based healthcare at the University of Oxford. I think both of those domains, health economics and evidence-based healthcare, really have a lot to contemplate when it comes to this idea of distributed analytics, distributed registry type tools in the health sciences. So for those who might not know me, my background has been mostly in the biotech and pharma space, a little bit in health policy. Interestingly, and this will age me a bit, but my first job out of grad school, I was working in Washington, DC, actually on immunization policy and pandemic preparedness in the early 2000s when we thought that bird flu was going to be the next pandemic. And it's kind of funny because we had really, really detailed plans for how to handle all of these aspects of a pandemic. And I mean, I remembered that these binders of plans existed, and then I think we must have just lost them in the intervening few decades, because I remember we had very detailed, I mean, I sat through days of meetings with CDC on how we would prioritize who got shots first for the bird flu pandemic. Of course, I mean, the thought was that we would be waiting for a really long time for a vaccine, because with the flu vaccine, you know, you have to grow each like a dose and a chicken egg and all this stuff. If you're not familiar with that, go read about it. It's kind of wild compared to the quickness that we've been able to deliver with these mRNA vaccines and others. But yeah, I think, ARKA, you're absolutely right. This is such a pressing issue, and we're at a unique moment in time where if we don't take this data and figure out how to use it, we're going to be just like we were at the beginning of this pandemic, caught a bit flat-footed and using, you know, we forgot stuff from 1918. In the 1918 pandemic, they put kids outside in school in their winter jackets and they said, open all the windows. I mean, we've lost, it's like the loss of knowledge or wisdom, even over 100 years in a very data and information enabled society has been kind of one of the weird things of this pandemic. So I'll leave it at that. I know we're going to get much more into the details.
Thank you, Jennifer. That was a great setup. I really appreciate it. It's so easy to be on one of these with you because you know you do so much of the heavy lifting. So I really appreciate that too.
No problem.
And then finally, SIRTAJ, who is actually doing much of the legwork here in making this platform real and helping us design and think through the product strategy. So SIRTAJ, a little bit about yourself.
Sure. Hey, thanks, ARKA. Hey, my name is SIRTAJ. As mentioned, I'm part of the team here at the Data Economics Company. My background is originally in math and science. I actually have degrees in math and physics from UC Berkeley. But really for the past 15 years, I've been building and deploying technology products, just working for a lot of different organizations, a lot of different verticals, pretty much learning and doing everything it takes to build a product and deploy it, top to bottom. And I'm excited to be here talking about, our work in a distributed database for like COVID data, COVID analytics.
Thank you so much, SIRTAJ. I really appreciate that, and all the hard work you're doing on this and many of the other products and solutions that we are building. So as I mentioned, the story of how we met and came to work with Charles is actually quite interesting, and actually a good illustration of how we go about building products at the Data Economics Company, and more specifically in identifying opportunities for using the Lydion DOS or Data Economic Operating System for building Lydion-backed solutions. which are implemented as DNets or data economic networks, within which users can assetize or package up their data into a standardized format. We call this standardized format a data asset, or a Lydion data asset to be specific, that lets it be valued, utilized, traded with others, while letting these users who are creating these data assets using their data track exactly who uses their data, for what, ensure that they are following the rules that are embedded within these data assets, and that credit for such utilizations of the data asset flows back to those who are producing and contributing the data into the system. So one of the types of problems that we are very interested in at the Data Economics Company, and you can read a lot more about this if you go to lydion.com/science, about the science of data economics, the Lydion data economic operating system, what it is, how it's used to build solutions. And we have a ton of video material also if you go to our lydion.com site/science, YouTube, etc. But I'll stop plugging all that, and I'll start talking about why I'm bringing all this up, because one of the reasons that we are, one of the types of problems that we are very interested in is in building solutions that involve some kind of a distributed database or registry that's created out of data sets that are completely disconnected. They don't talk to each other. They are in completely different formats. They can have very different usage rules, very different rules for credit flowing back to those who are contributing those data packages or data assets into that system, but can be used as a decentralized database to run queries, to generate rich analytics, and answer questions that none of these disconnected databases or data streams can answer by themselves. But when put together as a whole, without actually putting them together into a centralized database, actually be able to use them as a completely distributed, completely decentralized database that can answer these questions that none of them can by themselves. So as a result, what happens? This helps also create marketplaces where data producers or data contributors could make very heavily regulated, very heavily controlled pieces of their data available as data assets, and then get credit for its usage by those who are running queries and receiving analytics and other results from this completely distributed or decentralized database. So this idea of being able to create these highly regulated, highly controlled data marketplaces using data that could be potentially very sensitive, but when put together with other pieces of data while respecting their individual constraints, can together help us create answers, give us insights that none of them can. And you have words like federated learning, federated systems, etc. They all mean kind of the same thing. Anyway, so coming back to the story of us working, meeting and working with Charles, when we first started talking to Charles about almost a year and a half, almost 2 years ago at this point, COVID wasn't a reality at that point. But we kind of mutually identified, Charles and us, that given everything that Charles was working on, and he will tell you that he's working on a lot of different things at the same time, and interested in the domains that we were looking to apply, the Lydion DS technology and and the data economic science that was driving it, that there was something quite powerful lurking, just behind the curtain, just below the surface, if you will, that we could be building together. So Charles, why don't we start there? Why don't you tell us a little bit about how you got involved in the COVID response testing and this entire system that you guys have built up with ARKA in helping us deal with the pandemic?
Sure. So as ARKA was saying, our relationship here pre-existed the COVID space, and came from my background of both being an entrepreneur as well as investor across multiple sectors, and also in the US and in China, where particularly when looking at developing countries and seeing what was going on with their databases or development of such, and led into early conversations that then there was always something there lurking underneath that then once our activities in COVID started really presented itself as an opportunity. Now our ARKA's work in the pandemic and what we've looked at particularly here, and what we've seen is that the response was highly fragmented from a state, local, and federal level, as well as from between private and public as well. So in that way, even from the early days, whether it be from the perspective of what the response would be and what the proper response would be, protocols or otherwise, to then how to implement those and who was implementing those, was again all similarly highly fragmented, with a lot of players entering into the space that didn't necessarily come from the backgrounds that you would necessarily think that they would, and we're operating also under some pretty heavily wavered scenarios, right? That didn't put some of the strictures in place and frameworks in place that that you would normally see. And so that's where, from our perspective and how we came into working, particularly in some telemedicine pieces of response that had to do with statewide testing contracts, again, where you would say less than normal players were involved. We started seeing not only where we were picking up was in post-testing or helping design post-testing care for those state contracts, but what we saw and look back on was that there was enormous amounts of data that would be interesting to a number of different individuals, not only from a healthcare perspective, but also from a response perspective, that was going to be highly distributed and fragmented across those players. It's become more consolidated over time, but there is still, especially from the early days, a lot of heavily fragmented data that's out there. And so that's why this type of system, I think, would be very interesting because of, again, in the normal world, as ARKA said, a very regulated marketplace with a lot of security issues and privacy issues around it. But then secondarily, on the health side, but then secondarily, there's also response side to look back at operational efficiency and otherwise. And then longer term, also, as Jennifer was talking about, how do we plan for next time? Right, so taking that into view too. So those would be kind of the vectors that I would say we operated on, and that we then are looking back into in terms of this.
Yeah, and Charles, I would just add, because the response was so fragmented, actually from like an evidence generation and evidence-based policymaking standpoint, using this data could be a huge benefit to us, because there were actually naturally occurring almost cohorts of people where they were living in geographies where the response was different. And if we're able to query across those and design cohorts and design analytics to understand, what worked differently, not just from the healthcare intervention side, but things like, economic policy or spending on public health versus spending on other things, where areas had stricter kind of lockdown measures and versus where they didn't. Eventually, I think a lot of these COVID samples we have will probably sequence, and we'll be able to find out a lot more about the genetic or genomic evolution of the disease over time or in different areas. But as you said, all of that data is sitting in completely different places now, and there really is no incentive whatsoever. Like if I'm a lab doing the sequencing of that data, to share that with people that have done some analytics on like what did different local public health authorities in a certain area spend on messaging during like these weeks of the pandemic. I mean, so I completely agree with you. I mean, I think that's why we're all so passionate about this cause.
Jennifer, just staying with you for a second. I remember, because we were working heavily on many other things at the time, at the beginning of the pandemic, you were one of the first people who told me that we need to, and this was back in like almost December 2019 or something like that, where you started saying we need to take this seriously, because this is not going to just go away like SARS or something else that really did not impact the globe as much as it did specific regions of the world.
Yeah.
And I remember, I've seen firsthand that you did a lot to help with that in different ways. So maybe you could talk a little bit about kind of your involvement in kind of understanding the magnitude of this problem, kind of helping out, and a little bit more about kind of your firsthand kind of insights that has helped you both navigate, the the crazy amount of information that has been coming out, as well as some of the key insights that maybe our audience can benefit from, that you had, given your background in health policy and health economics.
Yeah, I mean, I think, Arga, this would just go to kind of a wider principle that I have considered a lot when looking at public health or health policy and these kinds of things over a historical trend. And that would be really like the network effects, both the physical network effects we have of airplanes, cruise ships, all of these things that contributed to the rapid spread of this disease, as well as like the network effects of the information, misinformation, disinformation that has been propagated really heavily during this pandemic. I think it's been a really big challenge for public health folks. I think things like Twitter are a double-edged sword, because there are people with huge followings that have a lot of authority and credibility when they speak as public health experts, but they may or may not have all the answers. And so the fact that you can look back and say, oh, this is what this person said in this date in March, and now that changed a month later. Well, yeah, because that's like science. We kind of go out there and say, this is like our best hypothesis at the time, so we think you should do this. And then our learnings evolve. I mean, I think this pandemic from the start was highly politicized. I mean, Charles, you have a lot of experience working in China, so you can probably talk more to the ex-US political factors at play here as well. But in the US, it was highly politicized. In some other countries, I think politicians like latched onto that, and you kind of had to take a stand. We've had so many information challenges throughout this time. I mean, I could see if I were just wanting to like spend the rest of my career doing a PhD on what happened in this pandemic, and there will be people who do that. They'll want to put together that data, the Twitter data, the like lab testing data, the spending data. I mean, there's so many different rich sources here to mine to understand like what really happened, what went well, what didn't go as well as it could have gone. And, I think like from my perspective, why the first awareness of this I had was really through places like Twitter and social media, to say like, hey, there's something going on in China. I mean, I think we don't know yet whether when we started hearing about it coming out of China, like how long had it been exactly going on there. I think from an epidemiology standpoint, there's a lot more work that has to be done. But again, these are pieces of data that if we aren't able to kind of like wrap our heads around them and put them together in some kind of way, we're not going to be able to get the full answers. And so my concern would be, I think all of these network effects in the world and the physical rate of travel and all the stuff in the world, I mean, there's a lot of data about how much the pandemic or infectious disease risk increases when humans encroach upon these different habitats and are getting closer and closer to kind of like where wildlife is living. All of this stuff puts the risk of another pandemic, it happening much more before the 100-year time frame. So we don't have 100 years to figure this out before it hits again. I think we were lucky that this disease was not more deadly, to be honest. And yeah, and then I also think we don't know what's going to happen with people who had COVID and what the long-term effects might be. This is still something we've got to figure out over time. Sorry, that was a bit long-winded, but
no, I think that again, great setup there. Thank you so much. I think all of those points are exactly what we want to get into a little bit more in terms of the need for what we are discussing here. Before we jump more into that, I want to focus on Charles for a second. And Charles, can you tell us a little bit, because definitely for us here on this session, as well as probably for the audience, not a lot of them have been as much on the front lines. I mean, I'm not saying that, you necessarily were, out there, like, testing people yourselves, or maybe you have been, but in terms of dealing with the actual fallout of the pandemic, you were, as close as it gets to the people who were getting impacted. So can you tell a little bit about, the work that, ARKA did in terms of the challenges faced, the achievements, and then leading into kind of the conversation that we started having about 6 months ago about the viability of the long-term viability of the businesses that have grown to support or help with the pandemic.
Yes, so some of that I don't want to be reiterative, but there was what we saw, and what Jennifer also pointed out towards as well, is that there was a lot of friction from the local, state, and federal level in terms of response. And we could even see how state rollouts of testing were denied by certain municipalities, and not just here where I am in Texas, but across the country, where different municipalities said, no, we do not want your state testing, turnkey testing in our municipality. We're going to run this ourselves and otherwise. So again, even from the start, kind of a fractured nature about where things were and being reported into, or who was really coordinating things and how protocols worked. So that was a major challenge throughout. I would say secondarily in that, and towards the data, to the data values that we can see and what was being captured where, there were a lot of political considerations, and that was more towards especially underserved communities and otherwise, and looking out for their interests, no doubt, on the long-term basis, and what they and places where they've been taken advantage of before and otherwise. But then how does that relate to also COVID response and the need for those certain data points or otherwise? So there was a lot of, let's say, different balls in the air that were trying to be managed all at the same time, which is one of the key challenges that we saw, let's say, at a government level, right? From a corporate level, different. You know, they're dealing with not only customers, but employees, and and trying to manage both of those. Wants, needs, values, etc. And so looking at that, as well as not having at arm's length or readily available public health experts, right? Most of these companies aren't dealing with this on a regular basis. And it's being really, in many cases, it was a combination of, you know, HR departments along with the executives trying to find their way through that. So that's where we stepped in many cases and helped bring those, let's say, hospital administrators or otherwise that were helping set up protocols for different smaller cities, and then bringing those those same folks at corporations to help work through those protocols. So it was those were a lot of the challenges that we saw, and what we did in terms of trying to respond to those challenges and bring best-in-class resources and protocols to them. I would say, you know, in a lot of cases, from implementation standpoints, it actually the pandemic itself necessitated an inversion of a lot of kind of traditional business models or labor utilization. So that was another challenge that we faced in trying to bring the right amount of labor to bear in this, and how to do that within the needs, wants, etc. of different clients, whether that be corporate or government.
Thanks so much, Charles. That is, you know, super comprehensive, and I really appreciate the answer. And I think let's take that next step into you know, just talking about what you and Jennifer have both touched upon, and I would love to hear from all three of you on this, which is, you know, what are the unique characteristics? We've talked a little bit about, you know, the potential unique nature of the data that's being collected during this time frame. So before we go and talk a little bit about, you know, how it can be used and valued and so on and so forth, what are your thoughts on some of these unique characteristics and whom those you know, that kind of data might be useful to? So why don't we start with SIRTAJ, since he's not had a chance to speak yet.
Hey, sure. You know, so thinking about the uniqueness of this data set, I just, you know, my first instinct is to compare it to what else we've seen. Jennifer mentioned a few other examples. You know, when was the last global pandemic? She mentioned, you know, the one in like 1918, 1919. You know, and the type of data, you know, there definitely was data collected around then, but definitely not computer based. Not to say that the data collected today is perfect, you know, as Charles called out, a lot of different sources, different places, you know, lots of opportunities for errors there. But nonetheless, I mean, like, this is a type of data that is being collected, you know, in a computerized fashion, probably for the first time. We can also compare in some ways to, again, you know, like, you know, I think Jen had mentioned like the bird flu and SARS and other things like that, right? Things that did not become global pandemics, but we're kind of the potential was there, and what type of things were there. So there probably there's some similarities over there, but nonetheless this still remains unique from just in the amount and the scale of what's going on over here. The only thing that I'll just really quick that I can think of that kind of compares in terms of the scale is maybe the seasonal flu, right? That's something, but then again, it's still a very different sort of issue, in terms of both the required response, how widespread, even just the amount of testing and other things that normally happen as a part of that versus what. So like just thinking about those things, I would we are looking at a pretty unique data set, right? I think there's going to be a lot of interesting things that we can pull out of this. I hope.
Absolutely.
There's a lot of interesting.
Yeah, Jennifer, why don't we, thank you so much, Sita. Jennifer, why don't you just continue with some of the thoughts that you were sharing earlier about the traits of the data?
Yeah, I think for me, it's more, most of this is about just like the urgency of getting this done, because I think this pandemic has been a once in a lifetime so far experience for many of us. And I don't want to be any kind of like doom and gloom person about this, but I think the probability is very high that many of us will see another similar pandemic-like situation again in the future. I think we can look at things that didn't become pandemics. That's a great example. Bird flu, Ebola, I think a lot of people were afraid would become a pandemic. Just from a purely like clinical standpoint, there were some different things about COVID-19 and SARS-CoV-2. This is a respiratory virus. Very likely now the data is telling us it has some airborne transmission. So very different than the first SARS outbreak or Ebola, where you really do have to have that very close contact, and the symptoms come on rather quickly. So you can isolate people. You don't have to have necessarily these large societal interventions. I think the other thing that is really interesting to consider are just like the healthcare resources now available, and the healthcare resources available in the U.S. economy and in the U.S. and Europe, where we have ICUs, we have ventilators, but we have had a lot of this response organized around making sure the health system doesn't collapse under the demand for these acute resources. There's tons of data, for example, that hospitals have about ICU usage. Most of them have never seen this kind of capacity demand at their hospital with patients that have one disease that's an infectious disease. So, I think we could talk all day about the unique pieces of this data set. The thing that I would really want to emphasize is the urgency that we should have around society to not just be kind of trying to make decisions to prepare for the next pandemic based on snapshots of data. We really have to make a very concerted effort to be able to bring these strands together. This has always been a massive problem in healthcare data. You guys know that I've worked most of my career in the cancer space. It's a massive problem in cancer. We get snapshots where you can see what happened to the patient in clinic, and then there's kind of this gap, and the patient probably went to the ER for some reason and got admitted to the hospital, but you have no idea what happened there. So it's very hard to put that picture together. I think that's a one patient example. I think we're looking at the societal example of this. We need to be able to put the picture together, because if not, we're going to make policy decisions that are not good. And we're not going to be able to prepare for the next time this happens. And even if we have, the great fortune that we had of vaccines coming relatively early, relatively quickly, having good efficacy and safety data, that might not happen again. So we really need to understand, the back to basics epidemiology and public health measures, where the spending should be applied, how we should manage this, information, disinformation issue. And the only way to do that is going to be able is going to be something that enables us to look at the data and really look at it holistically.
Thank you, Jen. And then going back to Charles. Charles, what are your thoughts about the nature of the data? You've expressed a couple of thoughts already, and then by extension, we've talked a little bit about whom the data can be useful for. So research, academia, government agencies, enterprises, and health sciences and other sectors. Pandemic prevention and readiness, which, to Jennifer's point, I think a lot of people are going to be very interested in, and a lot of I can see a lot of young people who are getting their education now being very, very interested in that field. How do you see that both the unique characteristics of the data as well as kind of the markets, if you will, of users who might be interested in accessing that data?
Yeah, so following on from Jennifer's point too, is that the value of it is intrinsic to it, right? In that we are looking to stop something in the future, to have this be a once in 100-year type event, and utilizing this data properly can help lead to that affect that type of outcome regardless of threat, right? And so that in and of itself, then it comes to your point, ARKA, about what data values are there, what data points are there, where can we access them, and how can we then bring them together, query them, analyze them, and synthesize thoughts for the future, programs to test, and the rest for how we respond. In terms of where they're housed, where that data is housed. Again, unlike in many other cases, at least from our perspective, there are some points of aggregation that we see, obviously like the CDC or otherwise, but if you're looking for higher resolution, that higher resolution is stored in a much more distributed, much more fragmented set of locations. As well, it needs to be normalized because you're relying upon patient entry a lot in that collection, and whether that even be by hand in some cases, and then conversion over. And so and then who did that standardization when it did get inputted, and the rest, because to a certain degree, and so it's there, that data is there, but it needs to be worked with a little bit. And because to a certain degree, yes, getting the data was important, but even more so it was getting the test out, or otherwise that was, the point of primacy in what was happening. And so therefore, there was that balance, especially in the very early days, about what was the most important, right? And that even goes again to who were the contractors that were doing this? Who was putting that out there? Who was stepping to the plate to do it? And that led to again, some things getting to market quickly, but other inefficiencies that might be in that market in that marketplace once it hit ground. That are highly valuable to look at. Again, to how do we look at government contracting in a crisis? Where does that worker go? How do people balance? How do governments balance other competing interests at that time, even from a disaster point of view, right? I mean, just because you have an epidemic going on doesn't mean you don't have a hurricane that's coming.
Right.
So
we had a pandemic and massive wildfires across a lot of the Western US last year at the same time. Exactly. And we were evacuating people into hotels and motels and stuff, or to their friends' houses at the same time we were telling people not to gather anywhere or to travel. So yeah, I mean, I completely agree with you, Charles. I mean, and ARKA, another thing that keeps coming into my mind, and Charles touched on the issue of privacy and like the sensitivity of this data. I don't think you can do this in a non-distributed fashion, because I think we're already seeing the backlash out there in social media. People don't want to have some kind of like vaccine passport that's global or a registry. They don't want to be, tracked in that way. People are more tuned in now to the risks of kind of surveillance, the risks of their personal data ending up in databases outside their control. But at the same time, people do want this problem to be managed, and they don't want to have to go through this again. So I do think the solution has to be a distributed network, and it has to be a way that maintains the privacy, the sensitivity concerns, but still allows the researchers, the policymakers to get to the answers.
Mm-hmm. Thank you, Jen. I appreciate that. Charles, going back to what you were saying, just taking that one step forward, how do you think about the value of this data, specifically, or the valuation framework for such data? And you can think about it from a pricing structure, but at a high level, given the people or the entities or the agencies or the markets, how do you think that they will go about valuing such data? And then I want to get Charles's thoughts on it, but then I also want to get Jen's and SIRTAJ's thoughts on it from an economics and data economics standpoint.
So I can look at that from a number of different perspectives, but one that I would like to hone in on is particularly what we saw both at the government level and at the corporate level, whether that be, in the government testing, a lot, again, positioned towards underserved communities but then we saw kind of lower socioeconomic communities from a corporate perspective as well, or middle income communities like where we saw outbreaks in South Dakota and otherwise at food manufacturing plants, things like that, how it worked, how the virus worked through blue collar workers and things of that nature. So then going back the other way in terms of value, and with higher resolution for groups like ACOs or otherwise that are trying to put in value-based care over a longer period of time, being able to know where their trouble hotspots might be or what they need to be looking out for and what they need to be ahead of. As those types of care models are rolled out, which I think many of us look to as part of the future and as part of aligned with what we're talking about here in terms of outcome-based care and otherwise. But so that would be one area, right? From both what we saw in the government and what we saw in kind of let's say the effects on those communities.
Thank you, Charles. And going back to Jen before going to SIRTAJ, Jennifer, what about your thoughts around? I mean, obviously we've had a lot of conversations around data, digital data, and how to value it and how it can actually represent value itself. How would you think about a valuation framework for essentially, the data that's coming out of the COVID pandemic and data that's coming out of pandemic or any of these crisis response type situations that we're talking about?
Absolutely. So I think we can look from a couple different angles. We can look from the angle of who would be users of this type of data set and how much, basically like a willingness to pay. What's the willingness to pay of a place like, when I sit with researchers at Oxford, what do we pay for these types of data sets? I mean, it's a good bit, right? Especially if we can have a university-wide license. And then I sit from the hat of when I was in biotech companies and advising them about data buys and stuff. Sometimes it's millions of dollars a year, $1 to $2 million a year subscription for data sets that have a couple 100,000 patients in them and things. So if we're thinking about data that represents millions of people, maybe it's even more if you're sitting at Pfizer or Moderna or one of the vaccine manufacturers. But I think more broadly than that, the value of doing this from just a societal standpoint, from maybe a government standpoint, we have to think about like, what is the value that we save if you could have had this pandemic be 10% less impactful, 20% less impactful, if you could have saved however many lives or prevented a certain number of cases. I think from a health economic standpoint, that would be very fascinating to model out. I'm sure there are people working on that kind of thing. But if the data enables you to reduce the severity of the next pandemic by, let's just say 30%, I'm just making up a number, that's trillions of dollars in value, because the world economy, despite rising stock market and all this stuff, we've lost trillions of value or had to infuse economies through stimulus packages and such all around the world with trillions of dollars. And so what if that could have been avoided? I think we'll also have downstream impacts of things like what's the impact in 20 years of all these kids that have had to spend 1 to 2 years on Zoom school and maybe have fell behind the learning of their peers versus other countries that controlled the pandemic better and their kids, didn't have to miss that much in-person class. There are downstream economic effects of this that I think we haven't even begun to really contemplate, let alone quantify. But in my mind, that's really the value of this data. Is what can you save from the next pandemic that could be clinically more severe? It could look different. We might look back in the next 100 years and say, wow, we got off relatively easy on this one. We don't know yet. That's why we need to do this. Is kind of my point.
Thank you, Jennifer. That is super insightful as always. SIRTAJ, going to you. There are two things I want to discuss. First is, obviously you've done a lot of work in the context of our work at DECO on formalizing valuation frameworks for digital data. And on the other hand, we are also taking the first steps, some very strong first steps in putting together the initial technology for this, the development of this distributed, decentralized database for COVID analytics, data query engine, and so on. So can you tell us both a little bit about how we are thinking about developing this? What are our first steps? And how are we planning to build out the initial kind of like, what is this product? What will the product look like? And how will some of the value and utilization models that we're talking about of the data come into play there?
So let me start a little bit, you know, in terms of like the value and utilization models and things like that. I think, you know, in terms of, you asked the question about like, oh, you know, like dollar value, what does that look like? And Jane made a couple of points there. I think, you know, there's a lot of research to be done, or a lot of maybe due diligence to be done over there in terms of like, hey, how much could this something, just as it is, how much could it be worth? But, you know, my preference really is more so to think about like, you know, really the utility that we can unlock, and then what is the additional value then? We talked a little bit about just the different, you know, different places that where we can use it. It was brought up in terms of just like you know, reducing the burden of the next pandemic, or even another outbreak, right? And or whether that's, you know, like public health changes, whether that's this data could be combined. It was also, you know, mentioned earlier about doing like, oh, there's some like potentially some naturally occurring cohorts against this data, which, you know, research could be done, and then using that to then better inform public health policy, you know, response, right? Government response, corporate, you know, private response, whatever that is, you know, including, you know, pharma companies, insurance companies, the actual practices and all of that, you know, that utility. So like, it's one thing to just sell a data feed and provide the data to someone. I think it's an even better thing, or for me, it's an even more interesting thing to be able to take it one step further and see, hey, what is all the utility that we can unlock with this data just by itself, or pulling in other data sets, pulling in, you know, I don't know, weather patterns, or you know, what disasters were happening and things like that, and how does that change the response, and what are the opportunities there to better inform and do better the next time. So then you asked a little bit about like, okay, you know, what are the next steps to building this? What does it look like? What I'd like to do actually, if it's okay, I'm going to throw up a couple of slides just to describe. Please,
that would be great.
Yeah.
Thank you.
Let me see if I can get this up here. Hopefully. Share my screen. All right, let me know if you guys can see that. Should we be looking at a slide that says distributed COVID analytics platform?
Yes,
okay.
Yes, we do. Thank
you. Great. This should look all familiar to my fellow panelists. I'm sure, you know, they've definitely seen it before. But I thought this was the best way, you know, in terms of describing like, hey, what does something like this look like? How does it work? This was just the easiest way for me, at least. That way, it's not just someone talking about it. You get a visual to go along with it. So what are we looking at here? You know, at the top there, basically we have like different data providers, right, that want to be able to contribute different. It's Charles's company, ARKA. It's others as well that have interesting data sets, you know, related to this, that want to be able to do it, but then also want to be able to do it in a way that, you know, they don't lose control of their data. They're not giving away the, you know, all of, they're not at risk for giving away, you know, their private information, not at risk for giving away, you know, or, you know, and they shouldn't be, right? And then, you know, you look at the bottom, who are potentially the folks that might be interested in it, right? Enterprise, universities, researchers, government agencies, you know, policymakers, and that sort of thing, right? And so what we wanted to build is a framework about, you know, if you're a data provider, if you want to supply this data, you know, how exactly can the data be used? What level of data do you want to, you know, be exposed? You know, is it just redacted data? Is it just high-level aggregate analytic data? You know, what do those allow different entities to kind of set their own rules, even their own rules about who they will be willing to share that data with? Maybe, you know, they have some restrictions they can't share outside the U.S. or whatever it is, right? Allow for those things, but then also, and then build a framework such that anytime someone does, you know, does contribute to, say, some analytics or some information, they get credit back for it, right? And that's kind of what's described here as the entities at the bottom kind of try to query that data. And then, as data with higher resolution, data with more information, data that, it's probably going to, fetch a higher price, or, whatever that, that utility is. And then you can start to think as well here, how, where we have data coming from other sources, right? That could be combined as well. So if I'm a researcher and I get this COVID data and then I want to compare it to, say, like, an income map or something like that, right? And how testing happened and what that looks like, they would have the opportunity to do things like that.
Yeah, so that just on that point, let's go to Jennifer and Charles, both in any order. What type of queries, given these different types of potential users of such a distributed query engine, what type of queries do you think that this engine or this database needs to be optimized for to be most useful, given the use cases that you're seeing arising from these potential user types?
I mean, I'll just give one example, ARKA. So imagine that we have, I'll just bubble it up to the state level so it's really simple. Say that we have all the test data, lab data from Pennsylvania and all the lab data from New Jersey next door. And we want to be able to compare the testing frequency and positivity rate and things across those states. And then we want to layer on another data set, which is maybe hospital data from those two states that happened 4 weeks or 6 weeks or 10 and 12 weeks later. Right now, all of those pieces sit in different places. And there's no way that you're going to get that a lab is going to want to turn over all of its data to a hospital, let alone all the labs in the state, right? So by having a distributed query ability across all of that, we can compare regional cohorts with the associated outcomes. If we have identifiable data there, we can do this so that the outcomes are in an anonymized fashion, right? The results are still anonymized, but we're able to essentially put patients back together, or even put, if we don't have patient identifiers, maybe we can put zip codes back together. We can get very granular, and we as humans never get to see that. We don't get to de-anonymize the data, but the computer, algorithms can do this for us. So that what is really exposed to us at the end are the insights for the queries that we're running without having to touch that sensitive data, which honestly, like if I'm sitting there as a university researcher, I don't want to have to be bound by the HIPAA controls and going into a sensitive data, space, even if that's in the cloud. I just want to be able to run my queries and get my answers. And if the program is telling me, yes, this all came from, verified sensitive data, that's good enough for me. I don't want to have that responsibility of having to try to put all of this together myself, or of handling that sensitive data. So that would be just a very high level example that I would give. But I mean, in an ideal world, we'd be able to layer the policy pieces, the economic pieces, timelines of what kinds of things are happening in the media or in policy decisions. All of that, I think, has relevance. And that's also what I think is fascinating about this project, is it allows these other pieces to kind of be bolted on in an ad hoc fashion as time goes on, when people have data that they're willing to allow that data to play in this network, and they can get compensated for it as well. They can get a share of the financial benefit, which I think will really incentivize people to want to participate in this network.
Thank you, Jennifer. And then Charles, I mean, we are coming up to time in a few minutes, so I'm going to start wrapping it up here. But going to Charles for a second. Charles, what are your thoughts on some of the optimizations that this kind of engine needs to make to be most useful to at least the initial set of users, and also SIRTAJ, if you're able to throw back your screen up for a second, I know we have a couple of slides on both sides of this kind of a marketplace, both the data providers as well as the data users, so to speak. So Charles, what do you think are going to be some of the challenges in that kind of go-to-market strategy in getting something like this going, in terms of getting the providers as well as the users engaged and into the overall network, so to speak?
Sure. One of the things here that we kind of touched on throughout is resolution and high resolution data. And I think in the first instance, the data sets that we're working with now in terms of their values and continuing to deepen those values to make it so that those values to the end user will have higher resolution. It's kind of a first order in kind of the iterative process of building this database, right? And that can be both from the data value as well as the locational regionality that you're focusing on to make sure that you have high resolution for those areas to look back on how those different elements can be utilized. For instance, as Jen is talking about, from the healthcare perspective or the operational perspective or the results quality perspective due to operations, and then being able to within that environment saying, oh, well, the average sample took 4 days to get tested, and therefore negatives need to be weighted this way within this geography, so that whether that be governmental or research or corporate or otherwise can have even some other qualifier on the data. So that would be kind of the approach that being thought of here in terms of how to first go and drive value, as we know that, as we said earlier, that we intrinsically believe that it does have value, and then bringing it out to those stakeholders in those geographies for which that data has value. And then, of course, doing that iteratively over time to a broader basis of maybe geography, but then also expanding upon the data values as we see opportunities that data value has been captured in multiple places and by multiple stakeholders.
Thank you, Charles. What a great answer. Since we are coming up to time, I'll just wrap up with, like, I guess, one last question to both Jennifer and SIRTAJ, which is kind of the same thing that I asked Charles, which is maybe starting with SIRTAJ and wrapping up with Jennifer. SIRTAJ, what do you see as kind of like the key steps in the go-to-market for this, both the data user experience as well as the data provider experience, or the challenges you foresee, and where do you think we can extend the use cases potentially of such a platform from beyond COVID pandemic to potentially other places?
So let me take that first one. In terms of like the next steps, it's really like, what we're working on right now is that first customer. What do we impress upon them, and what do we impress them with, right? And also it's a part of that, like, getting into the vision of what's really possible for this, across. Like, so the first few things, it's, anytime you're building a product, you're building something, it starts small, right? We want to get that first sort of analytics, distributed analytics query ability going, like you have up on the screen right now. Ability for some, one customer be able to do a query, be able to query a couple different data suppliers and then be able to get that result. And then for those those that are providing the data, for them to be able to, see that, hey, yes, I'm getting credit for this information. Being able to do that and just building up to that, right? And then slowly adding more complexity into the analytics, adding more complexity into, the types of data, right? What exactly, and then, all the while keeping our eye on the privacy of the data, keeping our eye on making sure that, everyone is comfortable with what's happening with the data that's under their control, and what type of analytics that come out of it. Yeah, so building out those first use cases. And Jen, maybe you'd like to take the second part of that question around, like, what does a bigger thing look like?
Sorry, what was that, SIRTAJ? What is the
ARKA's second question? Was kind of like the other uses.
Yeah, where can we go? Like,
where can we really go? Like, if you have a decentralized
sorry.
A distributed registry, so to speak.
My thought on this is that I think COVID is a fantastic place to start because of the level of attention being given to it, the resources available for it, and the fact that, like, we need to help organize how this data is being used quickly, and before it kind of gets like lost or evaporates, or it gets hidden on some hard drive in a basement somewhere that nobody thinks about it again. And in 5 to 10 years, as we start to kind of have our post-pandemic party mode, as people are talking about. So, I think that it's great to do this now with COVID, but there's so many different healthcare areas, both from the clinical standpoint and from the kind of logistics operational standpoint that Charles was talking about. We don't do a great job with a lot of these like basic public health things across the board. There are plenty of places we can intervene better, earlier, risk stratify better, understand like the geographic disparities of these problems, the access to care issues. I mean, like it's kind of infinite in my mind, the applicability of this type of distributed database or distributed, in effect, you almost get like a distributed registry without building that from the ground up. I think there might be cases where you might want to build a distributed registry from the ground up for new things as well. But really, I see limitless potential applications across the health sciences for this type of solution.
Thank you so much, Jennifer. And I believe we are at time. So what I'll do is just ask each of you for, just your closing thoughts in terms of anything, what you're excited about, what you're concerned about, or anything in the middle. I personally can't wait to get focused on working with this team here and our broader group over at DECO, over at ARKIS, and various partners we want to bring on to make this a reality, because wow, like it'll be so cool when we can actually touch and feel and see some of this stuff. But just having said that, I just wanted to see if any of you had any closing thoughts, starting with Jennifer, since we were with you.
Just to thank all of you for being here today and sharing this conversation. Thank you.
Thank you, Jennifer. What a delight as always. SIRTAJ?
I'll just say that, hey, I'm really excited to start, get going on this and showing, the real value that we can provide both for the suppliers, that have the data and the customers, people who can use it. Thank you,
SIRTAJ. Same here. And then, Charles, thank you so much for your engagement, for your friendship, and for, just being such a great, supporter of our technology even before we figured out, how we could use it. And thank you for bringing such a powerful opportunity, and making us aware of it. So, any thoughts from you?
Well, as always, thank you all so much for having me participate here today. And as always, so enjoyed it. And really looking forward, as like you all, of building this and as not only a platform that is top of mind right now for what we're doing to make sure that we capture the value of this data for the longer term, but then as a use case and example of what distributed databases can look like for so many different other implementations, so both here in the United States and obviously globally as well.
Thank you so much, Charles. Thank you, Jennifer. Thank you, SIRTAJ. And thank you to our audience, those who are with us here, as well as those who are going to be watching this later. We are actively looking for partners across health sciences and the tech sector to collaborate on this particular platform on. So if this sounds of interest to you, please reach out to me at ARKA, ARKA at Lydion.com. You can learn a lot more, as I said, about our science and technology at Lydion.com/science, Lydion.com/solutions. As I said, there are tons more festival sessions coming up. Today is packed with health sciences goodness. There is a great mixology hour coming up. There is a golf lesson coming up tomorrow, as well as a lot of other very interesting discussions ranging from health sciences, finance, climate, sustainability, agriculture, as well as really interesting topics in gaming, storytelling, and other fun stuff. So please check out Lydion.com/festival and let us know at festival@Lydion.com if there's anything we can do to enhance your festival experience. Thank you so much, everyone, and have a wonderful day.